Okay. You are live.
Good evening, everyone, and thank you for joining us tonight for the AKA and Sigma Community Vaccine Forum. My name is Charlene, and I will be your moderator for this evening. We'll begin in just a few short moments. So just some housekeeping rules for this evening. When the participants enter into the forum, everyone will be muted. If you have questions, please use the Q&A feature. And if you are joining us via Facebook, please use the comment feature. Okay, tonight we have some amazing organizations from the city of Trenton joining us. We have the Alpha Kappa Alpha Trenton Alumni Chapter. We have Phi Beta Sigma Trenton Alumni Chapter. We have Henry J. Austin Health Center. We also have Shiloh Baptist Church joining us. We have Catholic Charities, and we have Rutgers Institute for Health. So let's get into the panelists for tonight. I'm happy to introduce everyone here. We have Ms. Adrienne King. She is the president of Alpha Kappa Alpha Epsilon Upsilon Omega Chapter. We have Boynton Butch Weeks. He is the New Jersey State Sigma Beta Director, Chapter President for Lambda Lambda Sigma. We have Dr. Kemi Alli. She is the CEO of Henry J. Austin Health Center. We have Reverend Darrell LaRue Armstrong, who's the senior pastor over at Shiloh Baptist Church. We have Trenton Health Team's very own Stuart Altschuler, who is the Director of Analytics and Insights. We have Lauren DeVries, who is the Community Health Nurse Educator over at Catholic Charities. And last but not least, we have Dr. Dychtwald, who is the Research Project Coordinator for Rutgers Institute for Health, Health Policy, and Aging Research. We're going to ask Dr. Reverend Armstrong to lead us into an opening prayer for this evening.
Absolutely. Thank you, Ms. Phelps. I'm honored to be here tonight. Let us all pray. Dear God, out of recognition of the various religious traditions that are viewing and watching this gathering of minds, hearts, souls, and spirits, we ask your divine blessings upon us, that all that is said and done here today will not only be a blessing to your name, but that it may edify and fortify your people wherever they are around the globe. In this age of technology, we do not underestimate that there may be folk watching from every continent upon the planet and every ward within the city of Trenton. Bless now our conversation. May it enlighten us, may it empower us, may it encourage us. In thy name do we pray, and for thine kingdom's sake, that all of God's people say, amen.
Amen. Thank you, Reverend Armstrong, for that powerful and encouraging word of prayer. Next up, we're going to have greetings from the president. I'm going to just quickly introduce them again. We have Boynton Butch Weeks. He's the New Jersey State Sigma Director, Chapter President for Lambda Lambda Sigma. And we have Ms. Adrienne King, who is the president of Alpha Kappa Alpha Epsilon Upsilon Omega Chapter. Butch?
Oh, sorry about that. Great job. Thanks, Charlene. Good afternoon, everyone. Glad to be here and bring you greetings on behalf of our State Director, Brother David Moore, as well as our 27th Eastern Regional Director, the Honorable J.R. Reeves. I just want to thank all of our community partners, attendees. I'd be remiss, folks, if I didn't thank the tremendous teamwork and this collaboration with the Trenton Health Team, as well as Henry J. Austin, Phi Beta Sigma Fraternity, and the lovely ladies of Alpha Kappa Alpha Sorority Incorporated. If you don't know, folks, this is a series of continuing positive messaging regarding health and wellness and bringing that narrative to our community. So I am so very thankful and grateful for this partnership. And I want to thank in advance these expert panelists that are going to deliver some powerful information to our community. So I'm glad to be here and be a part of it. And I thank you, Charlene, for that introduction. And so I will hand the mic over to my good friend, Adrian King.
Thank you, Boynton Butch, and also to Charlene. Welcome, everyone. I bring you greetings on behalf of Alpha Kappa Alpha Sorority Incorporated from our international president, Dr. Glenda Glover, to our regional director, Mary Bentley Lamar, and those who all serve here in the city of Trenton, Epsilon Upsilon Omega chapter. We are elated to be a part of this conversation on today. One of our target areas is health and wellness. So we are excited to be able to deliver to the city of Trenton and our community experts that are able to talk more about COVID-19 and this pandemic that has affected each and every one of us in one way or another, some more personally than others. And as a result, joining with Mr. Weeks, as well as Trenton Health Team, as well as Henry J. Austin Health Center, as well as Rutgers University, we thought it not robbery to educate our community about COVID-19 and all the different questions that we are facing, questions we have ourselves, as well as we sit around the tables and talk to our family and friends about questions that they have. So I thank all of you for taking time out of your schedule today to get rid of so many myths. And I know we won't cover them all in this time frame, but just to know that they can reach out and follow up with Dr. Alli, as well as Rutgers University, as well as the brothers of Phi Beta Sigma and Alpha Kappa Alpha Sorority. We will continue to stand in the trenches and be of service to our community and provide the necessary information to talk about this pandemic, because we do realize it is a serious matter.
Awesome. Thank you so much, Butch and Adrian. I know I feel welcomed. Next, we're going to introduce Trenton Health Team's very own Stuart Altschuler. He will be providing us with details about current infection rates in Trenton and Mercer County. He's also going to be sharing a couple of slides to give us some visuals. Stuart, whenever you're ready.
Thank you, Charlene. Good afternoon, everyone. So what I have here is I do want to get into some information on how we're progressing or not progressing with the pandemic here in Trenton. But first, I think it's important to give a little context and broader and even take us out to the national level. So one of the things that we're seeing right now, and this was a headline yesterday, is that the epidemiologists have determined that we've heard about these variants, and there's the variant from the UK, B117. Well, that is now the most dominant strain of COVID in the US. What does that mean? I think we'll get into that a little bit later, but more specifically right now, it means that we have a strain of COVID that is more easily spread, may not be more dangerous in terms of mortality, but certainly more easily spread than the one that we've had out there. From a national level, look, I'm a Rutgers grad, I'm a Phillies fan. I love the color red. I don't like seeing the color red on this map because it indicates a more severe situation. You can see from the national level overall that the Northeast is particularly impacted right now with a more severe level of COVID spread. Taking it to New Jersey, and taking it to New Jersey over time. Beginning of January, we were at a pretty high level, and there were parts of New Jersey even at the most severe level of COVID. Progressing forward a month into February, things improved. We even started getting some moderation down in Salem County. Take it another month, mid-March. Look, Mercer County has moved from the second highest level of severity to the third highest level. That's really good news. But we've regressed a little since then. And now, as of yesterday, most of the state is red again, Mercer County at the critical level, and you even have Sussex County at the severe level, although I did check right before this meeting, Sussex County is back to critical again. More on Mercer County versus New Jersey. The blue line shows the number of cases per 100,000 residents since the beginning of the pandemic. And you can see since the beginning of the year that Mercer County has been tracking along with New Jersey, although the spread, Mercer County keeps doing better and better than the rest of the state over time. So overall, the state in a critical condition, Mercer doing a little bit better in that respect. So how has things progressed in Mercer over time? Back in January, again, we were about 40 cases per 100,000. That was a pretty high rate. We move into February. Look, we're down to 32 cases per 100,000. We're improving. Into March, we actually get to the third level. We're going in the right direction. But again, in the last couple of weeks, we've taken a little turn for the worse. We were actually above 30 a few days ago, now down to 27. Infection rate, which is another, or the retransmission rate that people look at, one person is infecting one other person. So you want that number below 1 if possible. So I've given you the overall picture, what's happening in Trenton. And so what I'm going to show you is based on data about the hospital visits to Capitol Health and St. Francis Medical Center over the past 4 weeks. I'm going to tell you we're looking at all COVID-related hospital visits. 2/3 of them are ER encounters. 1/3 tends to be an admission. Again, Capitol Health, St. Francis. We've looked at the 24 census tracts in Trenton. You're going to see that. And we've looked at 2 consecutive 14-day windows. So what do I mean? This is how things looked in the beginning to the middle of March, from 3/4 to 3/17. The darker the blue, the more COVID hospitalizations per 10,000 in that census tract. So we had a little bit more activity here and here, some in these various corners of Trenton. Move it forward 2 weeks to the point ending 3/31. Some areas improve, some areas have gotten a little worse. Here in the North Ward, we're now over 20 cases per 100,000, extending down into this census tract here. And we have a few other census tracts where we're seeing, again, some more hospitalizations per 100,000. And that's part of the context is we were doing very well in terms of the number of hospitalizations. And then about 3 to 4 weeks ago, our partners are saying they're starting to see more people come into the hospital. Final look here, who's coming into the hospital? This shows the age distribution. Back in last year around this time, around 16% of the folks were younger. They were age 30 and below. Now what we're seeing is that in terms of entering the emergency room or being admitted to the hospital, it's closer to 27%. So yes, if you're younger, there tends to be less risk, but we're seeing nearly a quarter of the folks in the hospital being the younger population. So what do we take away from this? The situation's critical, but still manageable. We've got this new B117 variant. The virus circulates more among the non-vaccinated. That's why we might be seeing more infections, more hospital visits, even though we're doing a good job of vaccination. And finally, while yes, the focus is on vaccination, we still need to pay attention to physical distancing, wearing of masks, and hygiene.
Thank you, Stuart, for that timely information. Next, we have Dr. Kemi Alli up. We have a short list of some frequently asked questions regarding COVID. So we're just going to engage Dr. Alli with some of the questions. Dr. Alli, one question is there a shot that is better than the other for the African-American community?
No, and to start off by saying no, but I also want to say thank you so much for this invitation. I'm so honored to be here with our distinguished guests and experts and individuals from our community, champions, leaders. Thank you again for the invitation. And reiterate no. So there are some differences between the vaccines, but not in terms of what I would say the real important characteristic. And that is no matter which vaccine you get, Pfizer, Moderna, or the Johnson & Johnson, they all three dramatically reduce severe cases of COVID, hospitalizations, and death. That is the most important thing, over 90% for all of them. So that is what I've told my family, my friends, and my loved ones. Whatever you can get, go get it. Whatever is available in your region, in your area that you have access to, that is what you should get. So I got Moderna, but my husband got Johnson & Johnson. He wanted one and done. My mom got Pfizer, another aunt got Moderna. So again, I recommend that we all get the vaccine that's available to us. And we may have some preferences. Like I said, the Moderna is 2 shots, but the Johnson & Johnson is 1. So that may be your preference, to get just 1 shot and then not have to come back.
Wow, thank you for that, Dr. Alli. Next question is, do you need to wear a mask or social distance while getting the shot?
Yes, so you should wear the mask once you get the shot, after you get the shot, and continue for into the foreseeable future. And that's important for a couple of reasons. One, the data is not quite clear that if I get the vaccine, and I have, is it possible I could still get COVID, not have symptoms and feel fine, but be able to spread COVID to someone that's unvaccinated? The data is not quite 100% sure that that is not a possibility. So for that reason, we really want to protect those in our community, our friends, our family, our loved ones. So for my example, when I'm out and about, I wear a mask, because again, I don't want to spread it to anyone who's unvaccinated. And then, Stuart talked about the variants. The data isn't 100%. There is some preliminary data that it is the vaccines are effective against the UK strain, which, as Stuart said, is the most predominant strain in our country. But there are other strains. There's the South African strain. There's a Brazilian strain. They are also rising within our state. The South African and Brazilian strains are in New Jersey. So there are various reasons why we should really continue to mask. And in fact, the new CDC recommendation, they put out an MMWR, morbidity mortality weekly report, that recommends double masking. And that's, again, what I've told my family, my friends, and my loved ones, to double mask or wear a mask that's made with a filter in between the layers.
That's phenomenal, because you just answered the next question, which is, am I able to contract or expose others to the virus? So moving on, if you already have COVID-19, if you already had it, can you get it again?
Yes, you can. So again, there's some real preliminary data, particularly coming out of Europe, that there are individuals that had COVID and got reinfected. Even here in Trenton, as Stuart's part of our Trenton Health Team meetings, and we meet 3 times a week, and there have been a couple of reported cases of EMS going out to pick someone up in the spring and then going back out to pick them up again in the fall to be hospitalized. So yes, and then also the variants. There is some evidence that individuals that had the original strain of COVID got better, subsequently got one of the new variants and got sick. So again, that's why the question of how important it is to mask again. So yes, it is possible to get COVID again. There is some evidence to suggest that.
Wow. So if you have antibodies build up from previously having COVID, do you still need to get vaccinated?
Yes. And so that just goes along right with what I said, right? That there are some individuals, the vast majority of people that will get COVID will get better. That is true. The vast majority of individuals will build immunization, but there are a group of individuals that don't build enough of a response. And so you never know who's who. So it is really recommended that anyone who had COVID, 90 days after your symptoms have resolved, you should get a vaccination, whether Moderna, Pfizer, or Johnson & Johnson.
Okay. And does the vaccine affect fertility?
No, it does not. So I know that is a really important question to answer. And one of the things I really, when I did my research, because I was concerned about this too, and I'm a pediatrician, so I have to counsel my young ladies and be really comfortable and confident that if this was my daughter, if this was my niece, would I recommend giving the vaccine to them. And so in doing that research, really came to understand how the vaccine is made. And really it's made from a clip, a little piece of either RNA or DNA from the viruses. And if you think about DNA, right, that double strand DNA that we all have, in the Johnson & Johnson, they took a little piece of it. In the Pfizer and Moderna, it's made from RNA, which is, I say, the cousin of DNA. And again, they took a little piece of it. So from those little pieces, there is no way for it to infect the DNA of our cells, because they're just little clips, and they are relatively unstable once they've done their job. So they go into our cells, they are duplicated and made into proteins, and it's the protein then that gets dispersed into our bodies. Our bodies recognize that and mount a response. They see those little things all floating around. But inside our cells, those little clips, those little pieces of either RNA from the Pfizer Moderna, or a little clip of the DNA from the Johnson & Johnson, they actually dissolve once they've done their job. And that's the science of it. That's really the beauty of it. And vaccines, even though COVID is new, vaccines and the method of vaccines is longstanding, both for the Moderna Pfizer methodology as well as the Johnson & Johnson methodology. They've been studied for decades. So even though the vaccine is new, the way in which they're manufactured is not. That's been studied for well over a decade and proven really to be safe.
Awesome. And our final question, because I know you have to hop off. How do you go about getting a vaccine?
Oh, that's the $1 million question, right? So actually, I will look to my partners at the Trenton Health Team. They created a really cool and really user-friendly page. And I don't know if somebody could maybe put it in the chat that goes step by step how you can go about getting a vaccine. And really, it boils down to 3 main ways. Number 1, we should all register on the New Jersey vaccine site, the state site that puts you in the queue. Number 2, you can look at various organizations. They give you a list and you can directly go to that organization. So for example, the third way I was going to mention is Henry J. Austin. You can go to our website and you can sign in to put your name on the wait list. So again, Trenton Health Team has a really nice step 1, do this, step 2, do this, step 3, do that.
Awesome. Well, thank you, Dr. Alli, for this.
You're so
I know
welcome.
this was a lot for me to digest. Thank you so much.
All right, you are very, very welcome.
Next up, we're going to have Lauren DeVries from Catholic Charities, and she's going to provide an overview of what Catholic Charities is doing in their partnership with LALDEF to expand access to COVID-19 testing and vaccinations in the community. Lauren, take it away. I don't know if Lauren is here. Okay, we'll circle back around to Lauren.
I was on mute. I'm sorry.
I'm sorry.
I was on mute. I'm so sorry. I didn't even realize. Want me to continue?
Yes, please.
Sorry. I'm so happy to be here on behalf of Catholic Charities, the Diocese of Trenton. We have partnerships with LALDEF to provide our community with COVID-19 education, testing, contact tracing, vaccine support to Mercer, Monmouth, and Ocean counties, especially to those in the Latin, Black, and documented and undocumented immigrant communities. We will serve as a COVID-19 vaccination administration and testing site. We want to remove barriers that increase access for marginalized groups. We will offer vaccine pre-registration, appointment scheduling, technology assistance, and referrals, for those who are in need for transportation to receive the vaccination, and also childcare vouchers. Transport will be provided by us, by our internal transportation department. We want to educate the community by creating wellness groups, working directly with vulnerable and hard to reach individuals through in-home engagement in multiple languages, and provide safe space for immigrants to ask questions and receive this information. We will help build a statewide bilingual multicultural COVID community corps health worker workforce in conjunction with community colleges. We want to encourage people to join the COVID community corps as volunteers to others to find access to the vaccinations. For COVID vaccinations pre-registrations, we want to we're encouraging everyone to go on to our website, CatholicCharitiesTrenton.org, or visit the direct link to our pre-registration site at cotmaestro.maestro.com. Also, I really do love the Trenton Health Team's step-by-step website, trentonhealthteam.org/COVID vaccine, to find links for Trenton residents to register at local vaccination sites such as Catholic Charities in Trenton, El Centro, LALDEF, Henry Dray Austin, and the City of Trenton. As a component of integrated healthcare services, at Catholic Charities, we are offering virtual exam rooms at several locations in our Mercer, Burlington County, and at LALDEF. We are working alongside LALDEF with our partnership to further outreach the Latino population and to reach the documented and undocumented immigrants. The virtual exam room provides comprehensive care to form the telemed, connecting consumers with primary healthcare providers, behavioral health, and other healthcare providers. Catholic Charities, in collaboration with Capital Health Systems, they will offer who offer the virtual exam rooms to the consumers, which will enhance the telemed visits through thoughtful video conferencing and technology. These virtual exam rooms will be offered in conjunction with nurse navigation services through the Behavioral Health Integrated Care, BHIC programs at Catholic Charities. The virtual exam room locations are expected to be at 10 different sites throughout Mercer and Burlington, and also at LALDEF. Catholic Charities personnel will be present at LALDEF every Tuesday and Thursday between the hours of 10 a.m. to 3 p.m. to assist clientele with navigating the virtual exam rooms to ensure clients' needs are met.
Awesome. Was that it, Lauren?
I'm sorry. No, I wasn't done. The process for connecting consumers to virtual exam rooms at Catholic Charities and LALDEF to connect our clients to these services will offer by direct referral of Catholic Charities consumers. And we will offer vaccination pre-registration, appointment scheduling, any technology assistance, especially those who don't have, who don't have computers or can't access technology. There will be a medical assistant care navigator that will serve the direct contact to behavioral home services, including navigation of service and connect to the virtual exam. And then done.
Hey, thank you so much.
A lot of information.
Oh, this is good stuff. This is good stuff. Thank you so much for joining us.
You're welcome.
Next up, we have Dr. Dan Dychtwald. Just like with Dr. Alli, we're going to engage Dr. Dan with some questions, some frequently asked questions. Dr. Dan, so our first question, can you explain to the group about the efficacy of each vaccine?
So number one, I'd like to reiterate Dr. Alli's sentiments and just thank you all for inviting me to be a part of this amazing panel and with all these esteemed panelists. So I do appreciate on behalf of Rutgers Institute for Health. Dr. Alli sort of addressed this question, and I think when it comes to efficacy, there's a lot of questions on everyone's minds. They all want to know, what's the best vaccine for me to get? And I think sometimes we allow the numbers to distract us from what's really important. And as Dr. Alli said, no matter what vaccine you are offered, what matters most is to get vaccinated. When it comes to the efficacy of all three vaccines, what people tend to focus on is that Johnson & Johnson overall tends to be less effective than the two mRNA vaccines from Moderna and Pfizer. But what you need to understand is that efficacy is looked at in different ways. So we're looking at the efficacy in terms of preventing mild cases, as well as cases that might require hospitalization or even death. And when it comes to all three vaccines, all three are 100% effective in ensuring that you do not get hospitalized or pass away due to exposure to COVID-19. They all protect against hospitalization and death. In terms of contracting a mild case, that's where the differences lie. But we have to also understand that being vaccinated does not prevent you from getting the disease, no matter which of the three vaccines you get. Even though you are vaccinated, you can still catch COVID-19. And while you may not exhibit any symptoms, this is why we continue to preach, as Dr. Alli said, the need to stick with the CDC requirements of mask wearing, social distancing, as well as keeping your hands washed. So again, it's as much as you want to focus on the numbers, what matters most is, again, getting that vaccination.
Awesome. You just answered one of the questions. Can you spread the virus after being fully vaccinated? You said yes. So let's just be aware of that one. I believe Dr. Alli also touched on this one. Is there a difference between Pfizer, Moderna, and the J&J vaccine?
Yeah, there are some small differences. So I'm actually going to go ahead and share some slides with you. And this is data that was actually collected as a part of the clinical trials that were done on all three vaccines. And the one thing that I do want to point out to all of you is you'll notice on the graph between the blue line and the reddish brown line is you start to see a split. And what we do in a clinical trial is we're actually determining efficacy by taking a group of individuals who enroll in the trial. Half of that group will get the vaccine itself, while the other group gets what we call a placebo, which in this case was saline solution, which is a fancy word for salt water. What you'll notice is around day 14, the lines start to split. And that's where you start to understand the efficacy of these vaccines. This one in particular is the Pfizer vaccine. And around day 14, those who were vaccinated, you start to see the line level out in terms of the number of new cases versus those that received the placebo. Those number of cases actually continue to rise. And if you look down at the bottom, out of 18,000 individuals that were part of this trial, 8 of them actually developed symptomatic COVID-19, while only 1 developed a severe form of the disease after being vaccinated, as compared to 162 that were diagnosed with symptomatic COVID-19 that received the placebo, and 9 that were diagnosed with severe. So that allows us to determine our efficacy rate for Pfizer of around 95%. The actual interval is between 90 and 97%. So it's around 95% accurate or effective. If you were to look at the Moderna vaccine, you'll see a very similar pattern. Around that 14th day is when you start to see separation. Here, the purple line versus the brown line. The purple line are those that received the placebo. That continues to climb while our brownish line starts to level out around that 14th day. What's interesting in the Moderna trial is only 11 developed symptomatic COVID-19 of those that received the vaccine versus those that received the placebo. 185 developed symptomatic COVID-19, while only 30 developed the severe form. So just like Moderna, we end up with an efficacy of around 95%, again, with an interval between 89 and 96. So again, an average about 94, 95%. Johnson & Johnson's going to be a little bit different, but again, you'll notice day 14, we start to see that split. Now, the Johnson & Johnson trial did not provide us the same breakdown that the Moderna and Pfizer trials did. But again, we are seeing the same trends. And the numbers that you hear about on the news in terms of J&J efficacy is not about those severe cases. When we talk about it being around 80% effective, it's about the symptomatic COVID-19, the type that you might not even exhibit any symptoms, but it's not going to be the type that would hospitalize you. So you may see more mild cases of COVID-19 should you receive the J&J vaccine. But remember, the purpose of these vaccines are to prevent hospitalization and death. And all three do that 100%.
Awesome. Thank you so much. Are the vaccines effective against the different strains of the virus?
Great question. First and foremost, it's still a question we're trying to answer. So far, preliminary data concerning the strain that Dr. Alli mentioned before, it seems like we do have some good efficacy against those strains. We are still looking at the Brazilian and the South African strains, but again, it's research in progress. So we have yet to determine what the true efficacy is with these strains. But one thing I do want to caution everyone about, because it's something that we are seeing, the vaccination cards that you all receive when you get vaccinated. I know a lot of people have been resorting to laminating them. And at this point, I'm going to advise against that because there is a possibility. And again, we're not sure of this, but there's a slight possibility that there could be a booster shot developed by all three manufacturers that would be actually given to all of us to ensure that we were protected further against the variants. We don't know that for sure. We continue to do research. And once we have those answers, it will be rolled out to the public. Our hopes is that it's not necessary, but we do want people to understand that that may happen simply because of the number of variants that are coming. And we've also started finding what's called a double variant, not necessarily prevalent here in the United States, but we are seeing it on a global basis where we have two variations within the virus appearing within the same strain. So we need to ensure that we protect ourselves, which is why the pharmaceutical companies continue to do testing to determine just how effective the three vaccines are with the different variants.
Wow. And finally, this last question is two-part. So how long does the vaccine last, and will I need to get another dose next year?
Again, that's a good question. Remember, these vaccines were only started to be tested last year. It's a relatively quick turnaround when you think about the overall scheme of testing and developing vaccines. What's amazing about these particular vaccines, although they did not skip any steps and they are completely safe and effective, what the science did in this instance was we actually ran phases at the same time. In a traditional vaccine study, you run a phase, it ends, and then you go into the next. With the three approved COVID-19 vaccines, we actually ran phases at the same time because the goal was to get the vaccine to market as quickly as possible. However, that did not affect either safety or efficacy, and all three vaccines have been approved by the FDA and are safe for use. However, in terms of how long it's going to last, we still don't know. The latest that we have heard is Pfizer, we know is effective for at least 6 months. And the reason we know that is because we have people that were enrolled in the study that have now gone 6 months since their second vaccination, and they have the same level of antibodies we would expect them to have after receiving the second dose. These folks that enrolled in that study are going to be reviewed for the next 2 years so that we can continue to monitor just how effective these vaccines are over the long term. So whether we will need a booster and how often we will need a booster, we have yet to determine that. However, once that research is available, as an institute, Rutgers will continue sharing it with the public to ensure each and every one of you are educated about the safety and efficacy, as well as the long-term efficacy of these vaccines.
Awesome. Thank you so much, Dr. Dan. Thank you for joining us.
My pleasure.
Okay, next we have something very, very special for you all. So we have 3 volunteers with us that will be sharing about their vaccine experience. I'm going to introduce them all together. But after each one goes, the next one can just pop in. So we have Reverend Armstrong, We have Miss Annette Lartigue, and we have Aaron Griffith. Reverend Armstrong?
If I can just take some license and defer to the beautiful ladies, ladies first.
Miss Annette? Miss Annette, you may be on mute.
I'm muted now. Hello, everybody. I'm Annette Lartigue, and I'm happy to be here to share my experience.
Yes, whenever you're ready.
Okay, so initially I was not going to get the vaccine. You know, transparency here. And after listening to several doctors and doing some research, I recognized two things. The first is that as someone at high risk, I'm diabetic, that I needed to ensure my health and well-being. And I've worked for years to deal with diabetes, and it just didn't make sense to drop dead for a lack of knowledge or understanding. So I did my homework and made a decision. It was in my best interest to be vaccinated, not just for myself, but also for the health and well-being of my community, to help flatten the curve. I needed to help flatten the curve. When I first went in to get the vaccine, I was nervous. I am not very friendly with needles. And so I expected a needle about that long or more. And I went in and it went smoothly. It was a tiny needle. It was just a little pinch, and I lived through it. I didn't have any effects from the first shot. But having done my homework with the second shot, I did experience, you know, what was projected, and that was mild flu-like symptoms for like 24 hours. And after that, I was fine. And that's the experience I share with others. I don't have 5 eyes, 12 fingers. My nose didn't twist to the back of my head, and I feel fine. And emotionally, I'm better off because I feel a lot safer. So that's my experience.
Oh, that's encouraging. That's very encouraging. Thank you so much, Ms. Lartigue. Aaron, take it away.
Hi, everyone. How are you? Happy to be here. Happy to join you. Thank you for having me. Similar to my sorority sister, Annette, I too was not really very interested in getting the vaccine at first. I was just a little bit skeptical seeing the fast turnaround and how new it was. And, you know, I was like, oh, what if my arm falls off? We don't have enough information about this. I'm just going to drink ginger tea and I'll be fine. After doing research and just kind of deciding that I wanted to be part of the solution and, you know, not necessarily part of the problem, right? Or this ongoing spread, I decided to get the vaccine. I am an elementary teacher. So I thought about, you know, myself, my example I was setting for my students as well. This was right before our school was preparing to, you know, reopen again full-fledged. So I just decided this was the best decision for me. And the process was very, very simple. Thankfully, I was able to, you know, get an appointment easily. You know, I felt very safe at the facility I was at. I got the Pfizer shot. I'm 1 shot down. I'm getting my second one next week. And luckily to say, you know, I haven't had any kind of symptoms. So everything has gone really well. And I've been trying to be a voice for some of my peers around me as well, and encourage them to go out and to get this. Thanks.
Awesome. I'm with you. I'm with you on to be a part of the solution. I'm with you on that. Reverend Armstrong.
Thank you. And again, I want to thank the beautiful ladies of Alpha Kappa Alpha Sorority Incorporated. Adrian King, you all always do a great job. And to my bros in blue and white, President Butch Weeks and Brother Dave Thompson for coordinating our involvement from our fraternity, Phi Beta Sigma Fraternity Incorporated. And to all of the other partners, I commend you. These kinds of educational forums are important. And as a representative that I believe stands in the gap in community, I'm all about engagement and education. So I took on the perspective that if my members in our congregation wanted to be vaccinated, it is my responsibility to ensure that they have every access point to get the vaccination, when it was one vaccine or two or three. And I want to commend the Honorable Mayor Reed Cusiora, Mercer County Executive Brian Hughes, the governor of our great state, Phil Murphy. They coordinated with FEMA to do a faith-based engagement initiative in about 10 cities around the state of New Jersey and the Garden State. Trenton was one of those. As a state capital, I would have expected nothing less. And 3,000 additional extra, I'm not quite sure what the correct terminology was, but 3,000 vaccines were made available. 60 pastors responded to the governor's initiative. That equated to about 50 members of each of our churches. And we were all encouraged to do our best to get members out. I had, and most of us had, an overwhelming response by our members. I couldn't take calls and emails and text messages fast enough, but I made the determination that we would start with our senior most elders amongst us. Shiloh has the blessing of having not one, not two, not three, not four, not five, but 6 centenarians, the oldest of whom is 103. The next 2 are 102. The next 3 are 101. And so to be the pastor of 608 years worth of living in the African-American community, I couldn't have thought of any greater gift. And it was my priority to make sure that those 6 centenarians got immediate access to the vaccine. And so we partnered with the mayor, with the county executive, with the governor, and on a given day, we were able to get all 6 of them, and within a given week, get all 6 of them vaccinated. And I can't tell you, what really touched me was not only the applause from the centenarians and their families. Thank you for getting my mother vaccinated. Thank you for getting my father vaccinated. But one of the FEMA, the National Guard, said one of the greatest honors I've had in this uniform was giving your member, 102-year-old Bessie Pfizer, a vaccine. And what a blessing. They all had, 4 of them had the blessed opportunity to meet the governor while they got vaccinated on that day. So it was just a win-win-win-win. I unfortunately, fortunately, whatever one might want to say, tested positive in January and did my quarantine and was fortunately able to retest negative within the 14-day period. Because of that, I had to wait. I'm still in my 90-day window before I can get vaccinated myself. So for me, it's all about engagement and education. I understand the historical atrocities of African descended people in the Americas from medical institutions, the great Tuskegee syphilis, or the infamous Tuskegee syphilis experiment tells us we have a reason to be distrustful, but at the same time, we have a reason to trust him. And I trust him more than I'm distrustful. So God bless you. Thank you.
Thank you so much, Reverend Armstrong. And thank you for the work that you and Shiloh are doing. And we're so glad that you recovered speedily. Thank you so much, everyone, for joining. Now we're going to open up the floor for a little bit of Q&A. We have some questions come through via Facebook. So I'm going to ask Dr. Dan if you would be available to answer some of these questions. Our first question is, and this was actually put in the chat twice. If my first shot was Moderna, can I get a different second shot?
You should not. You should actually get the same shot. With the Moderna and the Pfizer, when you receive your vaccination, you'll get your vaccination card, and it will indicate which vaccine you received. When you go to get shot number 2, whoever is administering that vaccine is going to ensure that you receive the same shot as you did for shot number 1. So you need to make sure you go back to the original facility where you got shot number 1 to ensure you receive that same vaccine twice. That's not the case with Johnson & Johnson, because right now Johnson & Johnson is one and done, so you don't need to return for a second dose.
Okay, that's very clear. So while we're still learning, excuse me, about the different shots, is it best to say get one as soon as possible?
Absolutely. As Dr. Ali said earlier, what matters most is getting vaccinated. No matter which of the three they're offering, they are all highly effective. And most importantly, the more people that get vaccinated, the greater we are going to reduce the spread of COVID-19. That's the key for us to return to normal. We need to reach herd immunity. And the only way that we can do that is by getting as many people vaccinated as possible.
Awesome. Someone says, Dr. Dan, what is considered herd immunity?
Herd immunity is when you have a certain number of people that have been vaccinated that basically reduces the spread of a virus, because that means there are fewer people available that can get sick. So if you think about some of the diseases many of you might have grown up with, like measles or polio or even mumps, it was in much larger quantities back in the 60s and 70s. More people were likely to catch any one of those diseases. But due to aggressive vaccination agendas that the United States adopted, their focus was really on getting children vaccinated while they were young. In many ways, we actually eliminated some of these diseases from actually being here in the United States. And while we've had some pockets of reoccurrences, thanks to everyone getting on board with vaccination, we've reduced the spread of these diseases and the likelihood that you may encounter or catch them later in life.
I'm sorry, I was on mute. Another question. Some people are afraid of taking the vaccine because they're afraid of long-term health consequences. Should we be worried about the vaccine causing negative health consequences?
So again, I'm going to piggyback on something Dr. Ali said earlier, and the science behind all three of these vaccines are not new. We've been using the science for decades. All we are doing is applying that science to a different disease, in this case, COVID-19. So in terms of long-term side effects, while we are still in the research phase, and yes, we've only started doing the vaccines over the last 6 months, for now, the answer is you have nothing to be concerned about. Again, it's not new technology. We're just taking old technology and applying it to a new problem. So you'll see the same side effects on the short term that you would with any other vaccine. But in terms of long-term side effects, at this point, we have yet to document any, and it should be similar to any other vaccine you've ever taken over the course of your lifetime, whether it be mumps, measles, rubella, whether it be chickenpox, any of the vaccines that you've taken, it should be similar in terms of both short and basically no long-term side effects.
Awesome. Thank you so much, Dr. Dan. This next question is for Lauren. It's more of an FYI, Lauren. So someone says that they spent 3 days calling LALDEF because some people wanted to sign up to know more about vaccine clinics, and they were having a bit of difficulty. They said that they also left messages in Spanish. So that's just an FYI. It wasn't really a question.
They can also call my work cell phone that I have on our flyer, and I can connect them to the proper places. I can give that out if you'd like. It's on the flyer. It's 609-819-6690. And you can feel free to call that number and I will help you get where you need to be.
Awesome. Thank you so much.
My pleasure.
Everyone, thank you so much. That's all for the questions. Listen, this was an awesome forum. Thank you all for your time. Thank you all for sharing with us your experiences and information and statistics. So that's going to be a wrap for us here at THT. So have a good evening, everyone.
Thank you. God bless.
Good job, Charlene.
Thank you.
Bye-bye.
Bye.